Okay, so good afternoon, everyone. Thank you so much for being here for today's presentation. We are very excited to kick off today's presentation. I know this is something that I have really been looking forward to. My name is Kayla Rogers, and I'm an Education and Outreach Coordinator for the Women's Fund. For those of you who may not be familiar with the Women's Fund, we are a not-for-profit organization located in Houston, Texas, and our mission is to provide women and girls with the tools that they need to be advocates for their health. So we do this through focused seminars like today's presentation, as well as curriculum-based classes and publications. All of our publications are completely free. You can visit our website, thewomensfund.org, to download PDF versions or complete a publication request form for physical copies. So if you have not yet visited our website, I highly encourage you to do so. There you can find upcoming events as well as our publications. So today we are very fortunate to have a presentation with Dr. Michelle Yedayamurthy. She will be talking about staying healthy in a digital world, which I think is a great topic for us at this point, as we have been virtually learning and working and meeting for quite some time now. So before we dive into the presentation, I do want to go ahead and tell you a little bit about our presenter. So after completing a Bachelor of Science in Neurobiology and a Bachelor of Arts in Tamil from the University of Texas at Austin, Dr. Yedayamurthy attended medical school at Texas Tech Health Science Center School of Medicine in Lubbock. She graduated in 2013 and completed a residency in internal medicine at Baylor College of Medicine in 2016 before joining Kelsey-Seybold. Dr. Yedayamurthy is a member of the American College of Physicians, the Texas Academy of Family Physicians, the American Medical Student Association, and the Texas Medical Association. She enjoys reading, running, and watching college football. And the most interesting place she has ever traveled is to Antarctica, her 7th continent to visit. Her favorite dessert is cookies, and her role models are her parents. So we are very, very fortunate to have you here today. I know I've been looking forward to this presentation, and I'm sure our participants would say the same. And so I will go ahead and turn the floor over to you at this point.
Thank you so much. Thanks everybody for attending this seminar. So we're going to talk about staying healthy in a digital world. So we'll start the presentation. If you don't mind going to the next slide. Okay, and then the next slide if you don't mind. Okay, so biggest thing is we're gonna be talking about today is screen time. And a good question to start with is, how much screen time do you actually spend? And if you think about screen time, there's obviously very many different sources of screen time. They're staring at a computer, which we all do at work. You know, when we get home, we might watch TV or play games. That's also considered screen time. Or probably the biggest culprit of screen time is, you know, playing on our phones or iPads or things or tablets at home or during work. That also contributes to screen time. So next slide. Okay, and screen time, it's definitely on the rise, especially during this time of this pandemic. We're using screens more and more to connect with different people. A recent report in 2014 showed that Americans spend usually about 11 hours of focused screen time each day. For kids, that same report showed that kids around 8 to 12 average more than 4 hours of screen time each day. Teens can average about 7 hours of screen time, and those estimates for kids don't include their school-related work or their homework, which I know that's also increased with screen time lately too. In families or other group settings, screen time is often spent with each person looking at their own device instead of having a shared conversation or experience as a group. Okay, next slide. Okay, tips to reduce screen time. Use a tracking app to monitor time spent on social media and texting. Actually, if you have an iPhone, they have a screen time monitor that will alert you when to put down your phone if you've been using it too long. You can also turn off your phone or put it in sleep mode or driving mode when you're interacting with others or during meal times. Another thing that we do in our household is during meal times, we actually take the phone and put it in like almost a whole different room so we don't even have it near us. Don't use your mobile devices in bed. We'll talk more about that later. And then disable social media notifications so that way you're not always getting pinged. And set a limit on the number of times you check your phone each hour, unless it's actually ringing. And you can also consider deleting social media apps from your phone and visiting their website on your computer for when you want to check for updates. Next slide. Okay, now we're going to talk a little bit about kids and screen time. So next slide, please. Okay, so the effects on screen time on children are pretty broad. So when children spend too much time in front of a screen, it can lead to a bunch of different things. The first and foremost problem is we see a rise in obesity. Usually when you're on your phone or playing on a screen or paying attention, you're pretty sedentary. So screen time increases sedentary time. And it also exposes children to commercials that promote unhealthy food like fast foods or things that are high in calorie. And while you're watching TV or whatever screen you're paying attention to, you tend to eat a little bit more without even thinking. We also notice that it causes a little bit of difficulty sleeping. It can increase the risk of anxiety and depression and attention disorders. And we also see a loss of social skills, like interacting with their other peers, and an increase in behavior problems as well. Next slide, please. So these are the recommendations for screen time for children. For infants, they should never be in front of a screen. That's not good. For kids age 2 to 4, maybe limit to about 1 hour of screen time each day, if not even less, if it's avoidable. And children age 5 or plus should be limited to no more than 2 hours of screen time per day. Next slide, please. Okay, tips to reduce your children's screen time. So keep the screens out of their bedrooms. Make sure they don't have a tablet or a TV or anything like that in their room. Decide with your kids which TV programs they can watch ahead of time and turn the TV off whenever those programs are over. During meal times, make sure the TV is turned off. And while they're doing their homework, also make sure the TV is off. Don't let kids snack or eat their meals while watching TV or using the computer. Asking them to eat at a table is a much better option away from screens. Encourage your children to play outside, spend time face to face with their friends, get some fresh air. That's way better than using just a screen. And then establish media-free zones in your home, like such as the kitchen or the dining room, things like that to help reduce the amount of screen time that they're having. Okay, next slide, please. Now we're going to talk a little bit about sedentary behavior. Next slide. Okay, so we tend to be seated while using a computer, looking at our phones or watching TV, and that creates for a lot of sitting. Too much sitting down can be pretty hazardous to your health, and it raises your risk of having diabetes, becoming obese, cardiovascular disease, even having blood clots like DVTs, and developing metabolic syndrome. It can also be a little bit hard on your muscles too, causing some back pain as well. On average, Americans spend 7.7 hours each day sitting or reclining. This is called sedentary behavior. Research shows that sitting down for 8 hours plus a day poses a risk of dying similar to obesity and smoking. However, you can combat that by getting 60 to 70 minutes of moderate exercise each day to offset that. And moderate exercise can be something as simple as walking at a brisk pace. Next slide, please. So how to combat sedentary behavior. Like we talked about, stand up and walk around every 30 minutes. You can even set a little timer on your watch or something like that, a little alarm that reminds you to get up and walk around every 30 minutes. You can also get an adjustable desk that can switch from sitting to standing while using your computer. And also think about going outside, participate in maybe hiking, running, or riding a bike, or even walking outside like we had talked about. Next slide, please. Okay, now we're going to talk about harmful blue light. Next slide. So this is a light spectrum that we usually see. And in this purple region is where we don't really see visible light. And anywhere from this blue area all the way to red, that's visible light. Next slide. So blue light from devices, what we're talking about is devices like phones, computers, tablets. They're all backlit screens and they have an increased exposure to blue light. Blue light usually boosts our attention, our reaction time, and mood. And this is all very beneficial during the waking hours. Exposure to blue light at night can make it difficult for you to fall asleep. Any light at night can actually depress your body's secretion of melatonin, which is one of the natural hormones that regulates your sleep-wake patterns. Blue light often suppresses melatonin to a greater degree than any other types of light. So having your phone or tablet or even computer in bed right before you sleep actually suppresses your sleep-wake cycle and kind of ruins sometimes your sleep. So avoiding use of your phone or tablet or whatever screen in bed is actually a really good idea. Next slide. So to regulate your exposure to blue light, some of the things you can do is you can use a dim red night light. Red tends to less likely suppress the melatonin than blue, especially if you need a night light at home. Avoid your screen use about 2 to 3 hours before bed. You could also try blue blocking glasses and special filters that can reduce the blue wavelength. And then during the day, making sure to get plenty of bright light exposure, and that can help regulate your circadian rhythm, which is your sleep-wake cycle, and that'll also help promote better sleep. Next slide. So now we're going to talk about computer vision syndrome. Next slide. And what is digital eye strain or computer vision syndrome? So it's prolonged use of computers, tablets, and smartphones can cause this computer vision syndrome. Your eyes tend to work harder while viewing a digital screen than a printed page. And these factors that cause this include screen brightness, color contrast, reflection, glare, and sharpness. Digital screens create a higher demand for focusing and movement. Uncorrected vision problems can contribute to severity of digital eye strain, and the angle and distance which you view your computer can also lead to poor posture, causing back and shoulder and neck pain as well. Next slide. So to prevent computer vision syndrome, you want to set up your workstation for success. Make sure your computer screen is about 4 to 5 inches below your eye level and about 20 to 28 inches from your eye. Position your screen to avoid reflections and glares. Make sure your chair is the right height and your feet should rest flat on the floor. Your wrist should not rest on the keyboard when typing. Make sure you also rest your eyes periodically. When you stare at screens, you actually tend to blink a little bit less. So actually consciously getting yourself to blink a little bit more frequently is very good. Rest for 15 minutes after 2 hours of continuous computer use. That can be just getting up, walking around, blinking a whole bunch, just something that doesn't involve staring at a screen. And use the 20-20-20 rule. For every 20 minutes of screen use, look away at something for 20 feet in the distance for 20 seconds. And that'll help give your eyes a break as well. Next slide. So some symptoms of the computer vision syndrome can be like eye strain, headaches, blurred vision, dry eyes, neck and shoulder pain. The treatment is usually repositioning yourself in front of a screen, vision therapy to improve eye movement and focus, and you might even need prescription glasses or contact lenses specifically for computer use. Next slide. Ergonomics, so that's what we're going to talk about now. Next slide, please. So this slide shows the perfect ergonomic workstation. In this slide, you can see that the person who's sitting at the desk has their monitor about 20 to 30 inches from their eyes at the correct angle. The monitor is tilted in the perfect position. Their hands are put in the right place to type. Their back and shoulders are perpendicular to their floor. Their chair offers back support. Their feet are rested flat on the floor. And this will create a better working environment and make you feel better when you have to work at a computer all day. Next slide, please. So laptops in general are not designed for prolonged use. The screen and the keyboard are too close together to achieve the right distance and angle for both typing and viewing. If you use a laptop each day, consider a docking station to a separate keyboard and monitor and a stand to properly position the screen. When resting, remove your hands completely from the keyboard or the mouse, and make sure you take short breaks to stretch or move around. Next slide. Okay, now we're going to talk about the pros and cons of social media. Next slide. So what's so great about social media? Zoom, kind of like what we're doing today, and other platforms have kept us connected during the pandemic, which is fantastic. Social media is also a way to share photos with family and friends who may not live nearby. And with the right approach and a few limits, it can be very fun. Next slide. So there are some negative consequences of social media. It can cause a feeling of inadequacy. Many photos that's shared on social media are enhanced or manipulated. People only tend to share the best moments of themselves, not their day-to-day, everyday lives that might be a little bit more mundane or even a bad day. And it also causes you to compare your life to the curated moments shared on friends' social media accounts. Social media can also cause fear of missing out. Endless scrolling on social media can make you feel like other people are having more fun or being more productive than you. So you want to limit the urge to impulsively check your phone or social media to diminish that feeling that you might miss out on something. Next slide, please. Social media can also cause some cyberbullying. Approximately 10% of teens report being bullied on social media, and cyberbullying can cause feelings of isolation, fear, poor concentration, depression, decreased self-esteem, and confidence. It can also cause self-absorption, especially if you're oversharing photos and thoughts on social media. It can create an unhealthy self-centeredness and can distance you from real-world relationships. And it can also cause you to avoid issues. So many use social media to distract themselves from unpleasant feelings or real-life situations. Social media is an unhealthy way to manage stress. Next slide. How much is too much? So is social media negatively impacting your mental health? So I'm going to say some thoughts, and I want to see if any of these describe yourself. So spending more time on social media than real world relationships, obsessively comparing yourself to others in your newsfeed, experiencing cyberbullying, being distracted from work or while driving, not taking the time for self-reflection, performing risky or dangerous feats just for likes, having sleep issues, having worsening anxiety or depression. If you said yes to any of these things, or if any of these things describe you, then maybe social media is negatively impacting you. There is no magic number of minutes or posts spent on social media that make it a problem. It's recognizing when social media use negatively impacts your life, work, or relationships. Positive feedback like likes, shares, or comments can trigger the release of dopamine in your brain, which can actually create a psychological dependence on social media. Next slide, please. Isolation and loneliness is our next topic. Next slide. So with this pandemic, we've all been having to stay home more and stay by ourselves a lot. Just know that we're all in the same boat. Many people have barely left their homes since March of 2020 and are experiencing a prolonged period of loneliness. Loneliness is tied to higher rates of anxiety, depression, and suicidal ideation. Poor or limited social interaction is associated with a 29% increased risk of heart disease and a 32% increased risk of stroke. So how to break this cycle? Anticipate joys. Anticipation of joys brings joy, even if it's as simple as anticipating the walk around the block you're going to take or driving through a park. That's something to focus on and bring you happiness. Focus on your self-care and continue your normal exercise routine, healthy eating habits, making sure you're being mindful and doing things like meditation to help center yourself. Fight loneliness with kindness. When you're preparing meals, maybe prepare an extra meal to share with a friend or somebody that's less fortunate, somebody that you can kind of take care of, because that brings you closer and happier with people. And then you can also Zoom with family. It's not just for work meetings. Zoom can be used to keep up with friends and family as well. Next slide. Staying connected while distance. So humans are social species. Our brains are wired to interact with each other. Keep in touch with family and friends via phone calls, video calls, text, and group chats. Regularly connect with your coworkers, even if you're working at home. If you're working and you're not working in the office, maybe, send them a message or do Zoom meetings so you can see other faces. Get social. Social media can be a good way to see what others are up to, but it's not a replacement for real connections. Schedule weekly calls or video chats to connect with your family or friends. Next slide. I think it's important to talk about how to unplug. So next slide. So time, learn your baseline. How much time are you investing in social media or screen time? Set a goal to reduce this time and track your progress. Establish a curfew to turn off the screens and stick with it. Create a space, create a media-free zone inside your home. Leave your phone in another room while eating dinner. Silence it if you bring it into the bedroom. Make sure you're not using it like right before you're going to bed while you're in your bed. And find alternatives to screen time or social media. You can read a book, you can read a magazine, do some crafts, do a puzzle, or even exercise or go for a walk, just something that gets you a little bit more active. Next slide. So you can also use digital tools to your advantage. You can get a fitness or step tracker to help you achieve your exercise goals, and they can also help you set those goals too. Studies show that using the step tracker or a fitness tracker consistently increases people's steps by over a mile each day. There's also mindfulness apps that you can do. They provide a guided mindfulness experience. There's online yoga classes that are easy to follow and increase flexibility and strength without visiting a gym. And you can do that right in the convenience of your home. And then, like we talked about, Zoom, group video calling tools such as Zoom, Microsoft Teams help you stay in touch with your loved ones and coworkers. Next slide. So that's all I have for you guys today. If you have any questions, please let me know. Thank you for listening to my presentation.
Awesome. Thank you so much for that presentation. I know that I I'm definitely going to start incorporating some of the tips that you mentioned. Some of the things I've already started to do, and I have seen a little bit of a difference. I was the person that would be on social media before I go to sleep. And so I've tried to cut that out to get better sleep, and I've seen some improvements. So I'm excited to start incorporating some of these tips into my daily life. I'm going to go ahead and open up the floor for any questions that you may have. We are a smaller group today, so if you want to unmute yourself to ask your questions, I know sometimes it can be difficult to type things out in the chat, or you can always submit your questions in the chat. I will be looking there as well. But to kick us off with questions, I have one. So my first question is, obviously you mentioned the pandemic and the fact that a lot of people have been working remotely since March of 2020, and that means increased screen times for many employees. So if we should continue to work from home for months to come, what recommendations would you give for both employees and employers?
So making sure at home, that's a great question, by the way. Making sure that your workspace at home is designated as your workspace is number one. You don't want to be working from your bed or, work even in your bedroom, maybe at the kitchen table or, somewhere that, or in an office, somewhere where you can dedicate that as your workspace is very key. Making sure you have the right setup, and that might be kind of going back to talking with your employer. Maybe instead of a laptop, using actually a screen that's adjustable and a keyboard as well to make sure, you're sitting in the right position, not causing yourself too much strain. And then another thing is getting up frequently, every 30 minutes or every hour, get up, go walk around the house, go take a short walk outside, something to get your blood flowing and kind of give your eyes a rest for a second. That'll all really help as well.
Thank you so much for that. I have some noise outside, so I'm going to try to get through this quickly. I see, Nan, you have a question if you want to go ahead and unmute.
Yes, Doctor, I did. Doctor, I have a question, and it's sort of the other end because I realized you were talking about children and screen time and from the other end of the age spectrum. But one question I have, because I've spent a lot of time with friends on the phones who are not very technologically savvy. And it's even more problematic right now because people are having telehealth visits with the pandemic. And what might the medical community do to provide some kind of direction or education to the aging population to help them with the technology that's before them?
So that's actually a really great question.
Yeah.
Thanks, Sam. One of the things I know that we do here at Kelsey is we have a pretty simple to use app that lets you connect for your video visits. And personally, I know myself and all my coworkers, if we can't get somebody on a video visit to make it work due to like technology constraints or, maybe the patient doesn't know how to use the technology just as well. We also have a couple of different apps that we can send out like a link to a patient and they can connect through that. And then also, if I can't get a hold of a patient on the video, I'll just call them too. So, making sure that your provider is a little bit flexible because these are trying times. We're trying to keep everybody safe at home. So I think video visits and telemedicine is very great for that aspect.
Thank you.
Absolutely. Thank you for your question, Nan.
Sure.
The next question that I have is about blue light. So you mentioned blue light glasses in the presentation. Do you feel like they really work? And does it matter if you buy them at, an eye care place or if you buy them off of Amazon?
So I think they work to a certain extent. I think that you can use them when you're using the computer for a couple of hours, but if you're using the computer for all day, every day, then no, they probably lose their effectiveness after a while. I think you buying them off of Amazon or any retail shop, that's completely fine. You can go to if you're experiencing any of those symptoms that we talked about, like, headaches, blurry vision, feeling like that your eyes are strained, you should go to your eye doctor and definitely get your eyes checked just to make sure the vision is okay.
Okay, great. That's good advice. I bought blue light glasses and I've been trying to be better about wearing them. It's hard to tell if they make a difference because I do spend so much time on the computer for work. But that's good to know. My next question is kind of more of your opinion, I guess. Around this term that has been going around, or this phrase that has been going around for a while now, Zoom fatigue. What are your thoughts on Zoom fatigue, or even just technology fatigue? We are using it so much in our daily lives before, just to interact with other people, and now we have to use it for work or we have to use it for school on top of all those other things that we were already using it for.
Right. Yeah, I do think there's such things as Zoom fatigue, or like what you were saying, technology fatigue. If you think back before this pandemic, if you were in a meeting, like several back-to-back meetings all day for 8 hours, you'd almost have something like meeting fatigue. We're doing the same thing, concentrating, sitting at the same, like doing the same action the whole day does make you actually a little bit more tired. The way to combat that, like we talked about before, is taking frequent breaks, getting up, pausing, looking away from the screen. That all helps quite a bit as well. But I do think that the Zoom fatigue and the technology fatigue, that's a real thing.
Yeah, I try to talk to my mom about it, and she's like, "What? You use technology all the time?" And I'm like, "Yeah, but it's just so much more now that I'm kind of getting burnt out on it." Um, Nan, I see that there's a hand still up. I don't know if you have another question.
I was just on the phone with my older sister this morning, telling her about being an advocate for the vaccine, the COVID vaccine. And I'm sort of going off on this tangent, so forgive me, doctor, but it deals with technology. But I was telling my sister to be an advocate, not just to wait for the vaccine to fall in her lap, but to go, because I spent the better part of 3 days, like going through patient portals and emailing people and saying, I'm one of those candidates. I want to get the vaccine. And I got it, and I get my booster on Friday. But it took a lot of work to be that advocate. And especially, and I don't want to make everything about the pandemic, because I think that a lot of this technology is going to continue after the pandemic is gone. How to make it easier for people who didn't grow up with technology to access healthcare. And a lot of people don't have computers or don't use computers. So what are we going to do?
So that's a great question. I think also, I'm glad you got your vaccine, and I encourage everybody who can get their vaccine to get it as soon as possible. I think that's probably the only way we're going to end this pandemic, but that's a side note. I'll get off my soapbox. But I think that you bring up a good point, with an elderly population, and some people who may not be as technologically savvy as other people, that presents a little bit of a barrier. So what I would recommend is, making sure you have like a family member or a friend or even a neighbor. I know we have an elderly neighbor that lives right next door to us. So we're just constantly checking in on her and making sure, has she like scheduled her appointment? Has she done this or done that? Making sure she's taking care of her health. So like, for instance, if you're technologically savvy and you know somebody who might be struggling a little bit, reaching out a helping hand to them would be a great idea, especially if they don't have those resources available for them.
Well, I guess what I'm hoping for is that maybe some of the larger medical systems in different regions, like Kelsey-Seybold, Memorial Hermann, Methodist, whatever, maybe some of those medical entities could start. And I realize they're supposed to be dealing with healthcare, but this is a component of healthcare now. Maybe they could have some online classes, or at least offer some things to people, because it's going to take a huge educational initiative to get people up to snuff. And there's even some people that I know that are pretty technologically savvy, but sometimes those portals aren't very user friendly. You've got to really, work at them. So I planted my seed. Maybe somebody, maybe the AMA, maybe it's even larger than just Houston's population, and it is. Maybe the AMA needs to be saying, this is the world of healthcare now. So maybe there needs to be an online tutorial or something that the AMA could offer to baby boomers, to seniors, to help them become more proficient.
Yeah, I think that's a great idea. I know here at Kelsey, whenever patients come in for their appointments, we try to walk them through that like app, the portal app that we have, and make sure they get it downloaded on their phone if they have a smartphone, or make sure they know how to access it through a computer. I think also one of the other things we do pretty well is not only do we do like an email campaign for those people who are not on the portal, we actually do actual physical phone calls. Our contact center reaches out. So like for the vaccine, for instance, when we get more supply, our contact center will start calling the people over 65 who don't have an online account with us. And that'll hopefully help get more people vaccinated.
That's great.
Yeah, that was a great question, Nan. At the beginning of all of this, I had to help my grandma with figuring out how to work Zoom because there were a lot of things that she was interested in attending, different presentations and events, and they were all virtual. So I think that's a really great point to bring up. It might start, maybe small. I know that the Women's Fund, at one point, we did screenshots and step by step, this is how you log on to this, and this is how you can repost something. So even if it's just starting with you and people that you're close with, I think that's still something.
Well, and let me plant the seed with you, Kayla, not just the doctor. Maybe the Women's Fund could offer some kind of tutorial. Like, if you're a baby boomer, I just had my 70th birthday, but I worked on computers all my life, and I was a big advocate for computer systems way back, in the 80s. Okay. And, but I think that maybe the Women's Fund could offer some programs for our senior members, because we've got a lot of senior members. It would be a way to pull them into the.
Absolutely. That is something that I'm taking a note of and that I can revisit. So thank you for bringing that up.
Sure, you're welcome.
But we have a few more questions here. The next question is, what advice do you have for new parents that are struggling with screen time? And what would be the best practice to try and not have any screen time at all?
So that's a great question. I think especially with new parents, just making sure your baby's not even near a screen is probably a good idea. I think for the first part, especially if your baby is like under 1 or 2, if you maybe finding other things to do besides screen time, like maybe listening to music or having them play with toys, or, reading books to them, which would be just fantastic. Those are all way better ideas to reduce screen time or eliminate screen time. Now, like, let's say your child is a little bit older and of the TV watching age, like we had talked about, having your child pick out maybe their 2 most favorite shows a day and just setting that, only allowing them to watch TV or the screen for that 1 hour per day. That would be a really good idea. And that would set some limits. And that way, both parties are happy. Parents are happy because it's less screen time, and then kids are happy because they got to watch their favorite show.
Great. I think that's great advice for anyone. All of us could probably do with limiting our screen time and setting some boundaries for ourselves. I guess a question that I have based off of that question is, so I know when you were talking about children and screen time earlier in the presentation, you had mentioned some statistics that were outside of screen time for educational purposes. So what are your thoughts around screen time for younger kids when it comes to like educational type videos?
So if you are using the screen for like, online learning, online schooling, obviously that's like a safe choice. And that's something that I wouldn't necessarily count as screen time with children. I would say outside of that, maybe I would try to limit screen time even more and be a little bit stricter, because if your child's spending all day in front of the screen on school, maybe taking a break once school is done, doing things that are a little bit more interactive, that would be something that I would do. And the same goes for adults too. Like, obviously, if you're working from home and you're having like meetings all day, or you're having to be on your computer all day, that's not something we can necessarily avoid, because we all need jobs and to earn our, well-being and everything. And so what I would recommend is, outside of those hours of work in school, finding other things, not just, other forms of screen time to supplement the rest of your day.
I see a hand up. Did you have another question?
Yes, yes. Doctor, do you have the name? You mentioned about ergonomics, and at times I have worked with places that had ergonomic specialists that could come in and, when I was having shoulder pains because I was, not using the computer screen properly. Do you have any names, any recommendations of people who are ergonomic consultants?
Unfortunately, I do not have any names. I can do a little bit of research and see if I can get you a list. I know here at Kelsey, like in terms of our work environment, we do have it's like an ergonomic consultant that comes around to each workstation just to make sure, everything is actually good and not causing any harm or anything like that. But she works for Kelsey. She's not an outside company, so I'm not quite sure.
Yeah. I was actually going to buy my daughter. I was going to buy a gift and have my daughter, because she's always, she's young, but she's always like, her neck bothers her because she lives on a computer. So
Right.
I was going to gift her somebody to come in and assess her workstation.
I think that's a great idea.
Yeah, that's a good gift idea. Okay, so another question that we have is, what advice do you have for someone that is trying to get away from social media and screen time? I think a lot of times we spend more time on social media than maybe we even realize. But for people who are trying to start down a new path or new journey, pick up new habits, what advice would you have for those who are just trying to start out with getting away from social media? I know you mentioned a few in the presentation, but I didn't know if you could expand on those things.
Yeah, so there's like certain things that you can do on most smartphones, is like set timers to be on certain apps. Like, for instance, we'll use Facebook because that's the most common form of social media that is widely used. You can set a timer on your phone that says, okay, I'm only allowed to use Facebook for, like, let's say an hour at a time, or look at it 15 minutes at a time. And then a little pop-up comes up and says, please put down your phone. So doing things like that helps. And then also creating times during your day, like especially around meal time, where maybe you have to put away your phone or put away your electronics. And then also, like what we had said about having media-free zones in your house, and make those media-free zones the most common zones that you use in your house, like the kitchen, the dining room, maybe even the living room. Maybe if you want to get on social media, you have to go sit in your office, and that will kind of turn you off a little bit less onto getting on social media.
I think that's a really good idea, limiting your social media use to certain areas in the home. And also, I had no idea about being able to kind of set timers for yourself for certain apps. I know that on my phone, it just does it automatically, but I'll get a report each week, this is your average amount of screen time each day, which is, had it never popped up, I probably never would have paid it any attention. But it's nice to have.
Yes.
And then the last question that I have is, so social media can often be presented in a negative light. You did mention some of the pros and cons associated with social media, but because it is so popular, especially amongst younger groups, is there any language that we could use to encourage teens to kind of use social media for the good things that it was intended to be used for. I know we saw a lot about the bullying, cyberbullying is a big thing, and comparing ourselves to other people. But is there any specific language that we could use to encourage anyone really to use social media for good purposes?
Yeah, so you can, a lot of times people use social media to do like community projects, maybe like raise awareness about certain conditions or certain like things that people are very passionate about. So I think using social media for things like that is a great idea. It's a much more productive use of social media than just, scrolling and seeing like the thousands of pictures or the posts that everybody has. And then, maybe teaching our teens that when we use social media, we shouldn't be so focused on like, posting the perfect post or getting the most likes or things like that, kind of taking away from that and teaching them to use social media for maybe more community involvement, things like that. That would probably be better.
Awesome. I know that social media has been a vital part of connecting, especially during the pandemic. And so I guess just finding some ways to look at it in a positive light and use it for positive, because it has helped so many people stay connected, and that's what it's intended to do.
Yes, I agree.
Does anyone else have any questions at this time? Okay, well, I have a few more slides to share before we sign off here.
No, but thank you, doctor, so much.
You're welcome.
Yes, thank you so much for this presentation and for answering all of our questions. This was really great. I feel like it came at a very appropriate time. I know a lot of us have been kind of struggling with our technology use and being in front of the screen so long. If you do have any questions or comments after this presentation, I know sometimes I walk away and the next day I think of something. So if you do have any questions or comments that come up, you can always email us at healtheducator@thewomensfund.org, and we will answer your questions for you. I also would like to take this opportunity to ask you to complete our survey for this presentation. Let us know how we did, if you liked it, if there are any things that we could do to improve, or if you have any topics in mind that you would like for us to cover. I will be sending out the survey link in the follow-up email. So if you're not able to jot this down now, I will be sending that link for you. I encourage you to follow us on our social media sites. We post upcoming events and other things that we have going on. And I also encourage you to visit our website to sign up for some of the upcoming presentations that we have. So tomorrow we have a presentation on goal setting and decision making. And then next week we have presentations on heart health, body image, and eating disorders. So I want to thank you all again for your time. Doctor, thank you for this wonderful presentation. And I wish you all the great rest of your day.
Thank you.
Thank you so much. Everybody stay safe and healthy.
Thank you. Thank you so much. Thanks, Kayla.
Thank you. Bye.